is concerning lots of us is the coronavirus and how we're dealing with it. And as I said in the full council meeting last week, as far as this council's concerned, business is as usual, will carry on, but of course we are putting a lot of contingency planning in. We do have Huda here, who's our public health lead. Before I ask at the table, I'm just going to make a sort of brief statement about exactly where we are, and then if there are any other questions, we can get Huda to answer them. So, as I'm sure you all know, the coronavirus has now been declared a pandemic by the World Health Organization. The Prime Minister was on telly just a few hours ago announcing that the government's really moved from the containment stage to the delay stage. So that what they're really trying to do is just slow the spread of the virus. So we move into spring and into summer, and the NHS has under less pressure from other seasonal illnesses, and then it has more facilities to concentrate on the coronavirus. I think it's true to say that we welcome the announcement of an additional £500 million hardship fund to support people across the country, and we're waiting to hear what our portion of that is, what our allocation it is. And that's going to help people who need to self-isolate. And as I said, we should know kind of what the details are in the next few days. You'll no doubt be aware that we've had 20 confirmed cases of coronavirus in the borough. There are no hotspots, and those who who've got it are isolated and in daily contact with Public Health England. And we know that the majority of the cases are indeed travel related. I want to reassure you that together with the government and NHS, we are well prepared to deal with this virus, and we have plans in place to manage the situation as it evolves. And I'd like to ask some of you about what those plans are. We're working with our colleagues in Westminster, and we're taking a bi-borough approach to our response so that we can share best practice and that we just avoid unnecessary duplication. We've got a strategic team of people dealing with this, and they're meeting daily, as well as a strategic and tactical pandemic advisory groups, which are both meeting weekly to monitor the situation and ensure that our contingency plans are up to date and robust, so that we can then take the necessary action that we need if we need to do so. We've also got a Borough Resilience Forum in order to coordinate with multi-agency partners, and we shared our plans with them. And in addition to that, the Council's also keen to establish a community resilience forum to work directly with residents' associations and groups within our community. Public Health England are the lead agency, and we are taking all our advice from them and being the conduit of that advice to our communities. And again, I'll say that what you've heard again and again on telly, you can prevent the spread of infection by covering your mouth and nose with a tissue, or indeed your sleeve if you don't have a tissue, but not your hands when you cough or sneeze, and put tissues in the bin straight away. And again, the message is, wash your hands, and wash your hands for more than 20 seconds. You've just got to do it thoroughly and frequently. Try and avoid close contact with people who are unwell. And of course, in some cases that won't be possible because you'll be caring for people who are unwell. But, until then, just take precautions. And the advice from Public Health England is that hand gel is 60% alcohol content or above is effective. But again, just, you don't need to spend £120 on Amazon buying these great big jars, just soap and water. However, we've also put hand sanitizers in our public buildings, including Kensington Town Hall, Chelsea Town Hall, and in our libraries. And we absolutely appreciate how important frequent communications with our communities is, and that's why we've been updating schools with the latest advice from Public Health England. We've got posters up in our libraries, children's centres and leisure centres. Our website has been continually updated, as the situation develops, and we're regularly putting on information on social media feeds, so Twitter, Nextdoor, Facebook. Today we've sent an e-newsletter to our residents' associations and community and voluntary organisations. And again, all businesses in the area have been sent information about where to find the latest advice for business on the government, which is actually on the government website, with their business rate bills, and we're going to try and continually update those as well. In addition, we have a team of 6 dedicated community development officers who are going to be out in the community passing on information from Public Health England to local groups and organisations. And we're also liaising with the Kensington and Chelsea Social Council as a voluntary sector lead, who will be able to give us best advice on most appropriate interventions, if they're required. And we're open to working in other ways with our residents, understanding their concerns and supporting them as the situation continues to evolve. And we absolutely appreciate that our communities and our friends and our neighbours are feeling extremely anxious and concerned, so that we're setting up a dedicated email address for queries from residents and businesses, and we'll publicise that in the next couple of days. And I think finally all we can say is to keep up with the latest situation. It's the council websites and the latest information advice from Public Health England